Hi, my name is Kathleen, and this is the video about day one post-op from the biological dental surgery. I had a consultation with my surgeon, and he was showing me videos of my surgery, and I've decided to not show too much graphic imagery, but there are a couple of things in this video, and I have put a viewer discretion up prior to each small, very short section of any of the live surgery images or images of teeth that have any red in them. So I hope that's helpful and enjoy learning about what the surgery was like.
The uppers here and the implant here. Okay, pretty much what we found yesterday is that these you have a little how do you say, the teeth were a little bit crowded, and this one was a little bit too palatal, and this one a little bit too vocal.
That's
That's
this
something.
implant did that. It
Okay, the
pushed this
implant
one
did the
back,
pressure.
yes, which was very
So
upsetting.
pretty much those are the extraction. We were extracting the roots. It was a little tip, as I told you. There are several tips there that at the end took me more than I expected. But I want to show you the infection. I was cleaning, I was removing the tip. The thing is that the sinus was too close that we had to be very, let's say, gently. Okay, that's the piezo. With the piezo, once I did the extraction, I removed the cysts and the infection. I was removing everything there. And I want to show you the infection. I think it's here. That's the cyst that I removed from there.
That's big.
Yeah, it was big. Okay, that's on the left side. Okay, the cyst around the let's say healthy root canals.
Okay.
Because you had no pain, you had nothing on the left side, but you saw the cyst that you had. Okay, so there was a big hole in both sides. Look, the infection, there was still a little cyst here. So I remove everything. That's the ozone. Cleaning with the ozone. Then PRF, bone graft, everything. Preparing for the implants. Those were the implants. The back one was very stable, and then I put the other one. The implants in position. Okay, and close. The implant removal. This is a kit to remove the implant without creating any trauma. So things kind of was very simple. We remove the implant here. Then the process was based on cleaning on the inner part. I decided to avoid like a big bone graft, but I did a smart technique. That's the name of this technique, created for Dr. Lee from he's from UPenn. Pretty much what we do is a small incision, then a tunnel. Okay, because after the extraction, I realized that you had a small, but you had a vocal plate of bone.
So
we didn't need that bone graft. So pretty much what we did is a tunnel, and then I filled everything up with bone graft. I'll show you in the CT scan later. I was preparing for the implant. There's a little mess with that.
That's okay.
Because it's not edited at all. But we clean everything, we prepare everything. That was the implant. Of course, we remove all the metal. We ozonate everything before. That's the implant position, the new one. I have to go back and forward. I'm completely sure that everything's okay. I was closing after the graft.
So there's no screw in there.
Nothing.
Okay.
In this technique, if you see, I create more bone than I needed, but it's better to be completely sure that me check. Okay, that was the sinus on the right side.
Okay.
It was the same thing, minimally invasive, a small incision. I was getting inside the sinus here. Look, that's the cyst. And that's it.
So did it just get vacuumed up in the little suction?
Yeah, I came with the suction. While it came, then I take it with the.
Okay.
There's a nice video. You need to find it.
How big was the cyst when you took it out?
I took it in several pieces,
Oh.
but at the end it was. That's a lot. I removed. I think I have this video here. Okay. So one piece here.
I would love to get some of these videos.
Yeah, it took me like almost like half an hour to remove everything there. But at the end I removed the whole cyst. Not bad. Yeah, that was the last part of the cyst. Are you okay?
Yeah, I'm totally fine.
Okay.
I'm
That was the lower, one of the lower teeth. If you see the root canal, a lot of metal inside with some pins through that's a lower root. Okay, those pins were like touching the bone. I'm gonna show you the cavitation. There was one cavitation that was a little bit more clear. Okay, that's the pus. I'm going back inside the cavitation.
Okay.
I just get in, open the cavitation, and look the liquid that came out from here. I'll show you here.
Okay.
This yellow
Uh-huh.
liquid, it came out from the bone. We reopen, and more liquid came out.
So it's not supposed to look all yellow.
Yeah,
And all that fatty stuff I've read
fatty
about.
stuff and yellowish liquid.
Necrotic.
Yeah, there's lots of bacteria. And that's
Oh, that one looks green. Yeah, what's that?
Yeah, at the end, the good thing is that we remove all the infections. We clean everything. We found a lot of infections, even more than I expected. I found a big infection on the upper left. The sinus was, now it's completely clean. After cleaning, I use ozone, ERF, so everything is covered. As well on the lower cavitations. The left one wasn't that bad, but the right one was. You saw this yellow liquid that is infection. I mean, lot of infection bacteria. So I opened, cleaned. Again, it took me like half an hour cleaning each cavitation, and then I fill it up with ERF, a little bit of antibiotic as well, ozone. Okay. Now you're free of infection. Do you have any numb sensation?
I have just more of some tightness from the swelling and a little bit of pressure. And I felt a little more numb right here today.
On the upper, yeah. But how about the lower?
But on the lower, not that I'm noticing.
Beautiful.
And I can move my
Yeah.
face now.
Beautiful. Yeah. The tightness here is normal. It's because of all the trauma. All the tightness here is because of all the inflammation. You're gonna take a little bit to get rid of that. And of course here, the main problem is the since we did a incision and bone graft and everything, there's always like infection and inflammation after that.
And so this tooth under the veneer, it's good.
It's good, I think.
We could look at redoing a veneer when
Yeah,
we come
maybe
back.
when you come back, the option will be to try to compensate. Put the implant in a neutral position and the veneer a little bit more forward or something like that. Okay?
Yeah, because my natural tooth got pushed back by the implant as soon as she put it in, and for the first couple of days it kept popping
Another-
back and forth. I was so mad because she was like, "I can't do anything about it."
Yeah, another option is to do Invisalign. You wanted to align the teeth. When you plan to go back?
August.
No,
Oh, where I
in
go
this
back.
trip.
Oh, Friday. A week from
Next Friday, the
Next
10th.
Friday,
Yeah.
okay.
Is it-
Because one option, if you want, I have another clinic that is like less than a mile from here. you can find an appointment with the orthodontist, and he can take a look if there is a chance to do an aligner in order to align the teeth.
Even with the
Yeah.
bases in, because they're not healed yet. So
Yeah,
it's
so
okay.
to align it, no, the implant won't be aligned at all because the implant cannot be moved. Okay? But the advantage is that one option that we can do is to remove the temporary, and with the aligners, put something like a fake tooth or something, so you'll be able to smile and nobody notice that you're gonna have the aligner, the holder, and the aligner will put the natural teeth completely together in order to prepare you when you come back for the final crown.
So I'm open to considering that because I want the dentist in Denver wanted me to do Invisalign.
You have to wait 4 months as a minimum, 6 ideal for the second stage. So that's gonna be perfect, like a time frame to align. And in your case, I think you're gonna need like 4 or 3 months with aligners. Okay. The thing is that I'm not sure if they're gonna ask you for a follow.
Oh, right.
Right. Okay. That's the other thing. But if you want, you can see him and of course make a decision. I mean, the other option is to redo the same thing, the veneer a little bit more forward or vocal. The only thing is that we have a limit because I'm gonna show you the initial picture.
It's just so big, that veneer, so I'd like it smaller also.
Yeah.
So I don't know how that works.
Yeah, but your veneer is in this one, right?
Yeah.
Okay. Yeah, but the main problem right now is that the area is too crowded. That is gonna be very difficult because this one is a little bit vocal, but this one also is a little bit palatal. And this one is vocal. This one is into a neutral position right now. In my opinion, the Invisalign have to open this a little bit, to widen the upper jaw, to create a little space to align all the teeth. Otherwise, you cannot have all the teeth completely or perfectly aligned. So everything looks good. I hope everything is clear for you.
Yeah.
We try always as much as we can to show everything to the patient to understand what happened.
Yeah. I was asking.
Yeah, there are some patients that they just don't want to have, don't want to see any bleeding part, but it's important you to understand how many infections you had. You had a lot of infections.
Makes a whole lot of sense.
Yeah,
Yes.
and that's why those infections were like confined, but inside the bone, it's very difficult for your body to get rid of it. And the main problem, at least on the upper molars, on all the root canals, is that the source of the infection were there. No, I mean you can take an antibiotic, you can do whatever you want, but if you don't remove the source of the infection, that's always gonna be there. So you can imagine your immune system working hard all the time trying to hold the infection in position.
When you saw the labs I sent with the neutrophils being low,
Yeah.
and I was like, what? It's the first time I saw that, but it's been a lot more frequent that I have a flare up, and it feels like I'm sick.
Yeah.
It feels like I even have a fever sometimes.
Yeah, but your immune system is overworking all the time. And the main problem at the end of of several years with this is that when you really need the immune system for something, I mean a cancer cell or something, then the immune system is gonna be completely weak because it's tired to working all the time trying to hold every kind of problem. So the idea of remove all the problems right now is that then in the future when you really need the immune system, it's gonna be perfect. Okay?
Yes.
Beautiful.
Thank you so
Okay,
much.
we're gonna schedule everything with
Okay.
a pleasure.
Thank you.
A pleasure.